of course you could go home, but who's taking care of you? Who's helping you get up? Right? At 70, your wife is most likely also 70, or your husband's also 70. He can't lift you if you're going to fall. And you can say, yes, you can get a cousin, or yes, it looks good if I send you home because then I'm famous. But the reality is, 70 years old, you should have the ability to stay overnight, and then you go home the next morning when you're up and you're moving. And that's better for you. It's better for everyone. And the reason I realize that more is that I do disc replacements in the neck or fusions in the neck. And if I do a disc replacement or a fusion in the cervical spine, you have to move the esophagus out of the way. So when you move the esophagus out of the way, as soon as you wake up, you get that feeling like, I can't swallow, or I can't eat, or I can't breathe. So it's a lot easier to have that feeling when there's a nurse sitting right around the corner than when you go home. I'll get 6 calls all through the night saying, should I go back to the hospital? How do I feel? When they're in the hospital, I get 0 calls and they still go home by 9, 10 o'clock. And it's the same feeling with a total knee. Of course they can go home. A total hip. Of course they can go home because they're not sick. These are healthy patients. But how would you want your grandmother to be treated? You want to be treated with respect and allow her to spend overnight, rest, have a therapist, get her walking, and then she can go right out the door the next morning. And that's kind of how we are at Hamilton. We let the patients decide how they feel. Of course, the insurance is also going to decide in this day and age. But for us, we let the patients decide how they feel and what they have surrounding them. If they have the infrastructure, then they can go home. But if they don't, spend the night. Let's make sure with our social workers that we get everything ready, and then you can go home.